everyone, and welcome to the 10th and final session of the Center for Healthcare Innovations 2020-2021 Patient and Public Engagement Lunchtime Learning Series. This session is a panel discussion with members of our Patient and Public Engagement Collaborative Partnership. And as attendees, your audio and video are muted to avoid interruptions, but you are more than welcome to share comments or questions with the panelists in the chat at any time. And we will have time for discussion towards the end. We also have closed captioning enabled, auto closed captioning, so you should be able to see that and turn it off using the bottom of your screen. And I would like to start by acknowledging that here in Winnipeg, we are on Treaty 1 land, home of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and homeland of the Métis Nation. In coming together today, we respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past. We recognize the ongoing present-day colonial violence that is faced by Indigenous peoples within healthcare, education, justice, child welfare, and government systems. And we dedicate ourselves to moving forward in partnership in a spirit of reconciliation and collaboration. In talking about patient and public engagement in health research, it is in fact Indigenous research methodologies that are at the forefront, and Indigenous scholars, researchers, and communities that we should be looking to. We hope that by the end of this session, our audience members will have increased awareness of diverse cultural practices, factors influencing online engagement, and factors influencing engagement with youth. All panelists are members of our collaborative partnership and have no other potential conflicts to disclose. Now, please join me in welcoming our panelists. Juanita is a student at the University of Manitoba, and she values the importance of individual voices being present and heard in research. She has experience both as a patient and in clinical research, and brings these dual perspectives to her work with CHI. Rose Roulette, unfortunately, one of our Indigenous Collaborative Partnership members, is unable to join us today, so we will have a little bit more time for discussion at the end and might end a little bit early. Angela Tessier, whose background is in science, immigrated to Canada from Ireland. She has a master's in biochemistry and worked for many years as a workplace educator in various industries. She also taught internationally trained professionals as an English as a second language, or ESL, instructor. And currently at Red River College, Angela is an assessment program analyst where she develops assessments and then implements customized solutions to enable students to succeed in their courses. In her spare time, she loves to bike, read, travel, and debate politics. And so I'll turn it over to Angela to get us started.
Good afternoon, and thank you so much for the opportunity to talk about a subject that is particularly close to my heart. And I'm couching it in when I talk about my work in terms of student engagement, as I considered the work that I also do with patient engagement, I saw that there were a number of similarities that need to be considered when we look at online engagement of people. But before I begin the discussions, I would just like to reiterate the importance of the foundation of all patient engagement. The bedrock of it is trust, and building trust and understanding between researchers and patient partners is absolutely crucial. So based on this particular bedrock, we can now begin to build our house in terms of this. And when I looked at the various factors that need to be considered when we're looking at technology, what I realized was that there are quantitative considerations, but there are also qualitative considerations. So quantitative considerations, first of all, when we're thinking about engaging patients, there needs to be an ease of access to computers or to cell phones. That's very, very important. Another consideration is the age and the quality of the equipment that patients maybe have, because so often if their equipment is too old, programs can't be downloaded, and therefore the experience that patients are going to have is going to be less than optimal. The next consideration is having a reliable Wi-Fi or adequate data plans. We've all experienced the situation when our internet is consistently breaking down. We've got poor internet connections. It's obviously going to limit our participation. But also, if someone is somewhat hesitant in terms of participating in patient engagement, it's going to somewhat diminish their confidence. And very often people will realize, oh, I can't do this. And so it's very important that people have a reliable or adequate data plans available. And last and certainly not least is that it's very important that patient engagement people have an appropriate physical space to meet online. It's a place that they can easily get to, and it is a safe place for them to meet. Let's move on to the qualitative considerations when we're looking at technology. First and foremost, it's been a tough year. And stress levels for many, many, many people is simply off the charts. And while we may feel that as researchers, you may think, oh, I really want this person to be involved in a particular research initiative, people may be too busy or too stressed simply just to be able to participate in patient engagement. So often people right now are simply going hour to hour, minute to minute, and adding patient engagement may simply be the straw that breaks the camel's back. So it's something that we have to be very, very cognizant of. The next qualitative consideration is whether or not people actually want to participate in an online environment. They may not be comfortable working in an online environment and may actually prefer to meet face-to-face. Again, it may leach into some of the quantitative considerations that we had talked about in terms of poor access to communication, poor Wi-Fi, et cetera, and while it may seem, oh, well, I prefer to meet face-to-face, it may actually be directly related to just poor equipment. Appropriate timing is another very important consideration. And again, when we're thinking about people, we need to connect with people at a time that is going to work for them, not for us. I've in fact taught math at midnight simply because that's what worked for the employees. So that's a very, very important consideration. The other magical part about being online in the past year in particular is that we can also bring patients in from other time zones that previously would not have been able to participate in a face-to-face situation. Now, of course, a 4 a.m. meeting from somebody who is working in Hawaii may not be appropriate, but it's something to consider. The next is privacy and confidentiality. Patient partners may not want others to see where they actually live for fear of judgment. So this again may discourage people from actually participating. On the other hand, our own patient partners may also not want family members, nor roommates, nor partners to know that they're actually involved in a patient engagement initiative. So this also has to be honored as well. And obviously one of the benefits of a face-to-face, when somebody can leave a physical environment and can go and meet in a safe and an accessible place. And last, but certainly not least, is the whole sense of comfort using online programs. And my understanding of this has expanded significantly in the last year. And one thing I have learned is that it's critical to provide non-judgmental, supportive information to guide people when they are using Zoom, when they're using WebEx, when they're using other programs. I was involved in a particular initiative in the fall of this year in which there were large numbers of seniors, and we used consistently Zoom. The program itself was 6 weeks in length, but consistently we had people coming who would come 10, 15 minutes before the session and would ask for the same information all the time in terms of, how do I change my name? Oh, how do I mute? How do I work on chat? And that enabled large numbers of people to participate in this actual event. So providing non-judgmental, supportive information is very, very important. A suggestion that one of my colleagues suggested was check in to see if there's an actual preferred program that your patient engagement cohort might like to use. So for example, I'm quite comfortable using Zoom, WebEx, Teams. Others may have a particular preference for Zoom. And I would encourage you to go with that particular program that works best for your cohort. The other piece to also consider is that, is the technology accessible to all? That's very, very important to consider. And that may be a case that, for example, on Zoom, we have live transcript available. Is that something that is incorporated into any of your online programs that needs to be available? And last, but again, not least, I think to help build trust, to help build understanding, I think it's critical to, again, explain in a non-judgmental tone how you can raise your hand, how you mute, how you use the chat feature. Again, it helps build the comfort using online programs. And we all know from our own personal experience that our knowledge has expanded significantly in the last year. The other strategy that I've noticed, particularly when I've attended a number of conferences just within the last month, and the use of interactive strategies, whether it's doing a little pop quiz, whether it's doing a poll, these are interactive strategies that, again, bring people in to get people engaged, get people involved. But again, to help increase people's comfort level, to help people understand, I think it's very important to explain. We're doing a poll now. These are the questions. It's also important to explain that patients' answers are anonymous, and the poll, the results that are given is just based on those who participate. That type of information, again, when we look at comfort, using online programs helps build that. So you will see that I have talked about qualitative and quantitative considerations in technology. I'm happy to take any questions that you may have.
I was about to start talking, but I was on mute, so I caught myself. Thank you so much, Angela. I think it's hard not to focus really on those considerations around our current context, right? Like, I know this, this session is a little more broad, but you can't ignore it. You can't ignore the context that we're working in now and how much things have changed. One thing I know that Rose wanted to mention that we had discussed previously was including instructions for how to use Zoom. And I had hoped to include these in the Eventbrite. However, I was not able to attach a PDF except as 7 different images, which would not have been helpful for anyone. So I will attach that to the email I send out to everyone who registered at the end. So we have some instructions for Zoom that would be helpful if you're engaging to send to participants ahead of time. And I would think producing something similar, if it's sharing a video or instructions with screenshots on how to use whatever technology you're engaging with, so people can have that on hand and even print it out if they want to. Thank you so much, Angela. And we'll shift gears a little bit now and turn it over to Juanita, who I believe will share some barriers, considerations, solutions from the engaging youth perspective.
Thank you, Trish. So yes, as Trish said, my name is Juanita. I am a student at UFM. And today I wanted to talk about more barriers and solutions while engaging both youth and young adults. So I myself have been engaged in research, and then also I have done clinical research. So I've seen a bit of both sides of the coin. So kind of three main things I wanted to touch on today are communication, empathy, and power imbalance that we may find when engaging youth in research. So first of all, a bit of backstory to go into the communication part. So I was first diagnosed with a rare illness when I was 13, and then I didn't get involved in anything about research until I was about 19. So it took about 7 years to figure the road out. So I think this is very important because a lot of the times I think the problem is in not knowing. And from the patient's perspective as a youth is really not knowing that the opportunity is there, because I feel that if, for example, in my case, if I had known that there was the possibility to engage in research ever since I was 13, I probably would have taken that opportunity rather than going through hoops and searching until I found something 7 years later. So I think that is a big problem, the fact that people don't know about these patient engagement opportunities, and also they might not even understand it at first when they find it, or don't even know how to start searching for it. So I think that is crucial. And a big problem is making it simple. So making the research terms, the opportunities in lay terms that people can understand. For example, I think like the first time I saw the word knowledge translation kind of sounds like easy to understand, but not really. You're like, what is that? Or even the word just patient engagement. It's like kind of sounds like a very fancy, complicated term. So then you might just be scared as soon as you see the word. And if you're a youth, even more intimidated by it. So I think putting things in lay terms, just like saying we want to know about your experience with this, makes it a lot easier than saying, do you want to be engaged as a patient in a research project, which sounds a lot more complicated. So and also one of the things is you're never given the information. So for example, for me, I ended up finding a TTP group on Facebook, but that was just out of me like searching on Google, and I don't even know or remember how even I landed on there, but it was not because anyone told me, and it was just pure like Google searches, because I was like, it's kind of crazy that there isn't a group about this. So I just started Googling and clicking and clicking until I found this Facebook group, and I was like, well, I can join this. So, but that took, as I said, 7 years to find that something existed. And at that point, kind of your experience changes and evolves. So I think communication is huge. And then in terms of also breaking it down, um, the use of, for example, like acronyms, breaking those down, especially like at the beginning, is super important, or just even at the recruitment stage or when you're looking for partners. If you just say, I don't know, to engage in PPE, like that even just deters you from even trying to understand the poster or whatever you're looking at, because you're not really going to go into search it. So putting things simple. And for example, I have, from a personal experience, I could draw this when I was then diagnosed with lupus, and then I remember the first time when they told me, my doctor just said, "Oh, you have SLE," and I knew what SLE meant just because I've done my research and I had been Googling about it and everything, so I knew that that was an acronym for it. But it never took like there was never a step after that where it was like, oh, do you know that SLE actually means this? So when I'm in that spot, I think of all the other people, and I'm have a science, I'm studying a bachelor's of science, so I kind of know some of those terms, but I'm thinking of someone who maybe has zero science knowledge or understanding that would want to get involved. And if they just tell you, oh, there's this SLE thing, you're like, what is that, right? So I think going that step further, and I find that when we are like professionals in what we do, we start just using acronyms as our daily language, and we forget that other people don't know. So I think that is very important. And then moving into my empathy point, I think there is a huge lack of maybe awareness that priorities for youth and for young adults change once their life changes or once a condition appears. And from a, let's say, non-patient perspective, I would think in the same way. If I was going to engage 15-year-old youth, let's say, I would think, okay, well, they're focused in high school. Like life priorities are different when you're 15. And you would think that those continue to be your priorities. But then I find that as soon as you get diagnosed with a condition, or as soon as there's a life-changing event, your priorities just switch completely. And even though that's not the norm, like you shouldn't be, or yeah, normally you wouldn't have those priorities. Now your priorities in life are different. So for example, for me, like once I got diagnosed when I was 13, my priorities just shifted completely. Now I was interested in medicine, I was interested in research, I was interested in knowing about this really rare condition, which 6 months before, nothing of that was important in my life. And I think that maybe as researchers, a lot of the times is like, oh, they might be focused in high school, their priorities are in this, they probably don't want to engage in this research because it may sound boring for them. But understanding, I guess, from an empathy standpoint, that your life changes and your priorities change, so you might be wanting to do that, just is very important. And yeah, it's like we care as much as anyone else, I think. Um, and if the opportunity was presented there, I feel like a lot of people would take it because it's something, at the end of the day, it's your life and it's about you, right? So you really want to find answers or help find answers for anything you can. And then in this terms, it's also very important to value just like all forms of knowledge and looking at each patient partner like with dignity in terms of, yes, even though they might be youth, like sometimes we might look at youth as like, oh, their point might not be as valuable, or like, yeah, their priorities might not be this one's. But their point might be like as valuable as an older patient partner in the group. And this ties again to, for example, getting partners from all, let's say, condition stages, because your perspective is going to change completely, let's say at the beginning of your diagnosis versus maybe 10 years or 5 years after it. And the perspective, the thoughts, your emotions, your feelings towards everything are just going to, the opinions you're going to bring to the group are going to be completely different. And I think as patients, sometimes that might be something, let's say, for example, in my case, I'm like too hard on myself in that case sometimes, because I'm like, oh, well, for example, when I was 13, maybe I could have brought all these different points because I was like struggling in the moment, in the battlefield. And then now I'm kind of more on the other side where I'm looking at things from a completely different perspective. But then I have to remind myself, like, my point right now is probably as valuable as the point that I would have had when I was in the middle of the battlefield, just because right now I have so many different perspectives looking back that I would have not had at the time, and then vice versa. At that time, I would have had completely different thoughts and perspective towards the research and everything that I've gained over the years. And then lastly, I would touch on power imbalance, which I think is crucial when engaging with youth and young adults, because you just have to remember you don't know what you don't know as a young adult or as a youth. And you might feel small, you might feel like you don't know enough, or like, oh, I'm too young for this. Who's going to kind of pay attention to my point? My point is not going to be valuable or important. And you also don't know like what's okay to ask and what might not be okay to ask. So like, oh, well, if I ask what this acronym or what these complicated words mean, then I might just seem like dumb, or that I didn't do like my homework or my research enough. And then you just maybe keep flowing and you missed a super important piece or acronym or word that would have moved things, like that would have solved 10 problems that came ahead of you. So, and you're just too scared to ask, what does this mean? Which is a very simple question, but it's part of like our egos, right? You just don't want to seem like you're dumb or little. So I think it is very important to offer the information from the beginning and give the information to them rather than just asking, oh, do you have any questions? Because the open-ended question of do you have any questions, a lot of the times we'll say yes, and we'll say no, and then we have yes 1,000 questions, but you're just too afraid to ask. But so I think maybe even given like prompts to questions, like, did this part make sense, or did this part about compensation, or even just like, for example, with CHI partners, so we're offered the parking, which is something I would never ask, or someone might not ever ask, because you're like, well, probably not. That might be like really just dumb question. But then if they told you, like they tell you, oh, here's the parking, or we offer this, then that it makes you think, okay, it's okay to ask a question like this. So just more giving the answers, or being specific to, is this part clear, or is there any of these words that you don't understand? Things like that, rather than is everything clear? Because probably most of the times we're going to answer yes, everything's clear, but not everything is not clear. And this power imbalance also draws back to what Angela was talking about, which is just trust and feeling comfortable, I think, both ways, from a patient perspective and a researcher's perspective, to being able to ask things in both ways. So I think from the researcher's point, it's also, you might also say, oh, is this question, like this topic might be a bit too far, or I don't know if they're comfortable answering these questions. So I think setting those, setting the stage from the beginning, like, is it okay if we ask these questions? And knowing that it's okay to ask like any question from both sides, as dumb or as simple, creates a floor of trust and makes it so much easier for it to go smooth, and for you not to feel small. Because sometimes I find that as a youth, you still think of adults as adults, greater, bigger. So if they're engaging, let's say, adults and youth or young adults, you're going to think, well, their opinion is going to be like more valuable. They know more, they have more life experience. When in reality, your opinion is as important. So kind of showing that there is no power imbalance there, that the researcher and then the older patient partners and the younger patient partners, they're all in the same playing field, and anything and everything is like treated the same, is very important for you to have the courage and to not be afraid to more speak up and say, and really participate and make your points valuable. And lastly, I think it's very important to show the patient partners and the youth that the research is more for them, with them, and not just more as like a participant, but showing the importance and how meaningful it can be that they engage with the researcher and in the same level, rather than just I'm doing this research for you, more like with you. Thank you.
Awesome. Thanks, Juanita. I feel like you packed so much knowledge into that 5-10 minutes there. Some excellent perspectives and just some comments from the audience saying, you know, good point. Perspectives do change with time and the amount of time lived with the experience of the disease. And I think too, not only for your involvement in the research and your contributions, but if you're working in a group with other patients, caregivers, families, to share those experiences, right? That can be really beneficial to help support each other, right? And someone else said, great point about avoiding, are there any questions? And oh my gosh, we talk about this so much. This blanket question of, is that okay? Or like, everything okay? Everyone good, right? And you're not really giving people a way to express you know, questions or confusion or dissent. It's funny too, especially in Zoom, you know, we have to be more careful about how we ask questions. So, you know, if that all makes sense to you, then we're good. And like, there's no way for people to say no. So you can maybe phrase it like, if anyone doesn't understand this acronym, raise your hand, you know, or something like that.
Or even
and,
like
yeah,
asking them like personally, because for example, I experienced this a lot with my classes throughout the past year. There's like, oh, does anyone have any questions? And then everyone's just like muted and no one wants to say anything because you're like, well, this question's probably super dumb. But then when the class ends, then everyone in the group chat is saying like, did anyone understand this? And everyone had the same question, but everyone was too afraid to ask, right? So maybe sometimes like even reaching out, if you have, let's say, I don't know, 3 patient partners, instead of maybe sending, like asking them all at the same time in the Zoom call, the 3 of them might be too afraid to ask. So maybe just reaching out to, just like, hi, Juanita, was this clear? Like once it's just one-to-one, sometimes you're more comfortable saying, okay, you know what, like actually, yes, this part, I have no clue what happened. So I think that can also make sure that everyone understood.
Perfect. Okay, so people are already rolling into the Q&A, which I love it. There's a couple questions in the chat. Just to let everyone on the call know, you can pop your questions into the chat to everyone, to me specifically. We can ask them for you, but you are also welcome to use the raise hand feature. So if you go into participants, there should be an option to raise your hand, and that's if you would like me to unmute you, so you can ask your question directly to either of our panelists or anyone else on the call. But I'll start with one of the questions from the chat here for Juanita. Someone is, Sarah Johnson is wondering if you can elaborate on the best ways you've encountered to give young people a sense that you're working with them in research.
I think first of all, like explaining it to their level. So I think it goes back to this power imbalance where if you just start kind of lecturing or talking right off the bat with words that a youth might not understand or that are like at your level, then like from the start, you're just going to be like, what is this? What did I get myself into? But if from the start, you're making it simple and just putting it like, I want to know about you, rather than it's not like I'm kind of doing a homework and I have to do it right as if you're a kid, but more of like, I want to do this with you and I want to know what you think. Makes me want to give my opinion in a sense that like freely, and knowing that there's trust and that I can speak without kind of fear.
For sure. Maureen Smith has their hand up, so I'm just asking to unmute you, Maureen, so you should be able to speak now.
Okay, thank you. Thank you, both Angela and Juanita. I have some questions for you, Angela, but I'm going to put them in the chat box. But for Juanita specifically, I co-lead an organization, a network called Inform Rare, and we have a youth advisory group, which is made up of youth from the ages of 12 to 17. And we're just beginning this, so it's all new to us. I have a question for some advice. So one of the things that we encounter, so we've hired a youth facilitator to run the meetings, because she's also a young woman who has a rare disease and, you know, can understand them. My issue is I usually write the communication that goes back and forth to them before the meetings, like to prepare them. And what I find is there's a big difference between a 12-year-old and a 17-year-old. So do you have any advice about, you know, how do I send those materials out? We try to keep them to a minimum, but still there's always something to review before the meeting that's going to meet the needs of the 12-year-old as well as the 17-year-old.
I would think the first thing that comes to my mind is keeping it as brief and simple as possible, because sometimes we don't like to read. So I think if you open an email and see like 4 documents, it might be like, oh, 4 documents.
I don't think that's specific to youth.
Whereas like, I think if you see 1, it's a lot nicer. So I think keeping it maybe as brief, and sometimes I find that you might not know what's important in the document and what's not important, or some of the documents for like a lot of patient research or things like this have like a lot of text, and a lot of text that's not important to the meeting specifically, you know. And some is like more logistical stuff or things like that that are like, well, I don't really need to pay attention to that. So maybe I would, if possible, like dive into the point as quick and as simple as possible, because I feel like that would meet the needs of both, even though I think in terms of language, if you keep it simple to the 12-year-old, I feel like it would be fine for the 17-year-old as well. So I would keep in mind, I would maybe like prioritize making it as simple as possible for the 12-year-old, because if the 12-year-old can understand it, then I would assume the 17-year-old can.
Fantastic. I have another question in the chat. I'm trying to go in the order that these questions are being asked, and I see Rich has his hand raised. I will get to you shortly. A question from RS. Do youth value monetary recognition for participating more than other age groups? I don't know if you can speak to that, but what other incentives might encourage youth to participate if monetary recognition is not an option for the organization?
I personally think, I think monetary fits for everyone, from my experience. And even like, for example, in my experience, like I remember my first year of university, they were like, oh, do you want to come do some research with this robot and we'll give you like a $10 gift card? I'm like, sure, it's fun to play with a robot and I'll get a $10 gift card, why not? So like personally, I can speak from my experience that motivates me. But I think also even when I started joining kind of these patient partners group, I wasn't even aware about the monetary recognition. So it ended up being more of a surprise that I was getting monetary recognition. Whereas and I don't know if that's the case for everyone, but I think that when your priorities are like aligned with doing this, or you are interested in doing it, yes, it's nice to have, let's say, the money or the gift card, but it's also not like a requirement in this case. I would also be happy to do it without monetary recognition, as long as it's something obviously that you're interested in, that you're passionate about. And I think it's kind of like a fine line, because you also don't want to just kind of get fake, not fake, but yeah, maybe like not ask real answers or ask passionate people just like, oh, we're paying you like this amount if you come tell me about this. And then you're like, maybe someone who's not as passionate might say like, wow, that's a nice thing. So let's go. Um, so I think it can be like a very fine line, but I think if money is not an option, I don't see why you would still not get people, as long as you paint it in a way that you show how important it is and how their opinion is valuable and meaningful to you, and that their words are also going to be valued.
I think it speaks also to, like you were mentioning about not making people ask. That's another thing, compensation. Being very upfront about, does this pay or not? Some people can't afford to make the time to engage unless there is money attached to it, right? Like it is what it is. So not making people ask, especially about things like that, or parking or other accommodations, offering those upfront, being, not leaving it up to the potential patient partner, especially youth, to ask if they're being paid. And I know Carrie mentioned in the chat too, she says, my 13-year-old gets angry when people give only gift cards. She wants to be paid for her time. She looks at it as a job. Although options are really good, others might feel differently, right? Like it depends on the individual. I think, Guy,
yeah, I just wanted to add as well, when it comes to youth, their age, parents sometimes need to also be involved. And I know, Juanita, going back to your point around dignity, respect, and power balance, youth should be treated equally and their knowledge should be valued. And so they should be equally compensated as we would adults. However, there is a vulnerability piece attached, and there are times that we do need to make sure that we're not giving $100 into their account, that we do have some conversations with parents as well as the youth or the child to make sure that we are doing it in a way that's safe for them. So a lot of times it's having that conversations, and the families can come with a solution that best fits that unique needs of that family at that time. Just wanted to add.
I agree. And I think adding to that, I would say sometimes as a youth, there might be things that you might want to say that you might not want your parents to know, just like everything. There's conversations you want to have with your friends that you don't want to tell your parents about, or things like that. So I think that maybe sometimes having, like, it's important to have the conversation with both, but then also designing a space. If you're engaging the youth, make sure you're talking to the youth, because that's something that happens a lot, and that I've found in my experience, where let's say I would go to an appointment and then it was like they were talking to my mom, but yes, I was kind of like on the side, again, because we might assume like, oh, well, they're not going to understand anyway. So the parent is the one that we should talk to or address. So I think having a space to talk to both, as a guy saying, but also designing a space to talk to the youth specifically, and being like, okay, you can talk here in a safe space.
fantastic. Okay, I'm going to give Rich Sobel a chance. So Rich, you should be able to unmute yourself to ask your question or comment.
Hi, I was going to also put my video on, but it doesn't allow me to do that.
I'm not sure. I can't figure it out. Sorry.
Don't worry. You don't need to see me. The picture's good enough. I just wanted to thank both of the presenters, Angela and Juanita, but I'm really, really fascinated by the stuff Juanita has been talking about. And one of the things, as a research navigator for SPORE, so one of my jobs is to constantly reach out and find people who become patient partners. And so, for instance, one of the things we do is to give presentations to nursing classes in universities, just to kind of spread the idea of what patient partners are, because there's such a huge deficit in the population of people don't even know that there's such a thing as patient partners. So I see Juanita and the younger people as this huge, resource that we should be educating to this whole concept of what patient partners are, so that if a young person comes down with a condition, then they actually know that they can speak up about this. So my question to you, Juanita, is how do we make this whole concept known in the younger population? I mean, I sort of put that in the chat and someone said use social media. Well, I'm sorry, but a couple of little social media things is not going to work if I want to, get all the young people in Canada to know what a patient partner is. So what do you say to that?
Yeah, I think this is a hard one, which I often think about. And as you're saying, a lot of the times the term patient partner is unknown. Like even for myself, like Angela was the one who told me about it. And if it wasn't for Angela who told me about it, I feel like I would have never found out about it. So just like that as important. Yeah. And then I think like, yeah, social media can be one, because yes, we spend a lot of time there and more now. But I also think maybe kind of like old ways, just like posters, maybe a doctor's office or things like that, or even at school, like there's like the post banners. Well, not right now, but not COVID times. Like the banners that are at school, and then like you can put posters up. Like I find, for example, like I read those all the time, and that's how I got involved in different like research projects as participant or things like that. And even like I know, for example, at my doctor's office, there's always like a banner, and then there's sometimes posters like, oh, do you want to join this group or things like that. So I think that can be a good resource. And I would also, yeah, like recur to social media. That's also an option. But yeah, I think it's a lot of word of mouth and making it like if you're doing a poster or even a social media, it needs to be like in simple terms, because as soon as you see like patient partner, you're probably just going to scroll because you have no idea what that is. But making it simple, even like at the doctor's office, and even for example, like after I was diagnosed, I started looking for groups, and then I also found Lupus Canada, which at that point I found it because I was like, well, if there's something for TTP, there has to be something for lupus. So that one took me only like a week to find out. So that one was much quicker than 7 years. So even maybe like reaching to those organizations that may have young patients with in their social media following them might be a good resource as well, I think.
And just to quickly follow up, so you don't think it would be worth it, for instance, post-COVID, to do presentations in a high school, for instance, as an assembly?
I actually think that would be I would have never thought about that, and I think that would be really cool. As you're saying, like teaching the nursing students just like a presentation about what patient partners is, I think that's really important. But I would also maybe like expand it, or maybe like create maybe like a session where not only nursing students can attend, but anyone can attend, right? Like because there might not be only nursing students. So, and I think reaching down to the high school level would also be very, very valuable. Like I think if that had been my case where I was in high school and I would have had a presentation about like patient partners, so you can do this, I would have been in right away.
Thank you.
No problem.
We have
If I
another
could take
question.
that point, I think in
There we
this post-COVID time, I think we've got a great opportunity to, when we look at what has happened from a science perspective, from a research perspective, when you consider a year ago, we didn't even have a vaccine, and where we are now, research and science has been front and center in terms of what we have achieved. And I think we can capitalize on that and then draw people in and simply say to the public, you have a role to play in this. So I think it's very, very important. Rich, I think your idea of going into high schools, I think is very, very important. And just getting the public involved and making them aware of the fact that, yes, they have a voice in research.
And even something as simple as clarifying what research is. Because, for example, like I started hearing about research when I got maybe like probably my first year of university, which was a bit too late, I think, maybe. And then at the beginning, when you hear about research, I didn't get involved during my first year. Like I heard about it, but didn't go to a research talk or anything, because it just seemed like, oh, they're probably gonna just talk about like microbiome, and like you just imagine like the labs with pipettes, and that's all you might think about. But you're not aware that research goes so much farther than that, and that you don't have to be sitting in a chemistry lab, which is your typical thought about research, in order to do research. So just starting like even from there, like even in a high school presentation, doing like, you can get involved in this, and this is what research can be, like expand the view since the beginning. Because sometimes it's just scary even to see like, oh, involved in research, and you might be like, oh wait, that sounds too complicated, and just out of my league. But in reality, it's that the view, it's not expanded to what research can be.
All right. Maybe I'll shoot one last question. There's tons of conversation in the chat. This is fantastic. And Angela, you kind of already answered this. Oh, now I've almost lost it. So Maureen mentions sometimes patient partners who are only available to meet on weekends or request meetings on weekends. How do you find balance planning meetings when it suits patient and public partners, and respecting research teams' need for time with families and rest? So I don't know if you want to speak further to that, or Juanita, if you want to speak to that.
Yeah, my suggestion was simply if perhaps researchers could work with some flex time, and I completely understand that. So it's just sort of sometimes just finding a balance. That's what I can suggest. I also, yeah, that's what I can suggest in terms of weekend work.
And I'll say from, you know, the engagement practitioner perspective, that's what our team does. There's a lot of evening work. So far we have not had to do weekend work for the most part. Once in a while it comes up, but usually we're able to flex things throughout the week. But yeah, you know, I think it's important to have the employer and the surrounding context of work be supportive of the nature of patient engagement, how much time it takes, how much work it can actually be, and emotional work as well, right? And having an understanding of that and appreciation and support for that is really, really key. Oh, so much conversation in the chat here. Yeah, also taking into consideration language barriers, sharing information in a culturally appropriate way. And someone mentioned earlier too about, you know, the power imbalance, different cultures. I feel like it all goes back to that discussing early on with patient and public partners what their needs are. I think both of you spoke to that last year. We had, when COVID first started, we had the session on pre-assessment of needs for engagement, right? Any other considerations that might be important for that you can think of, aside from what you've already mentioned?
I don't think so, but I was going to add something to Rich's question or answer, I guess. For example, I think also if you search, like how I found the TTP group was because I started searching in Google, and then I found that took me to a Facebook like TTP patient group, where there's mostly people from the States, but a few from Canada. And I find a lot of the times they post things there like, oh, there's this researcher looking for partners or looking for patients to be participants in this research. So I think that can also be a good way. And once you start digging in groups, you can find a lot.
Right, yep. Discussion in the chat about Brady faculty at University of Manitoba. May be able to introduce patient partners through there. Some really fantastic ideas in the chat, but I do see we're getting close to the end of the hour. So I'd like to thank again, Angela and Juanita for joining us and sharing your perspectives. As always, it has been an incredibly valuable experience for myself and for everyone involved. I'm just going to put info in the chat. This is our last session for the year. However, and I'm just going to share my screen here. We do have some Angela again, who is a member of our collaborative partnership, as well as Paula, Carrie Costello and her daughter Emma, and Dr. Anna Hudick will be sharing their perspectives on lessons learned in the past year engaging during the COVID-19 pandemic online, virtually. And that's for our grand round on June 24th from 12 to 1 p.m. I will share this info, link to the evaluation in a follow-up email to everyone who registered and joined us today. I would like to thank you again all for attending and sharing, and I hope you take good care of yourselves and enjoy the summer. All right, bye now.